everyone. Welcome to Behind the Mask, the uncensored story of your dentist. And I'm your host, Weber. And today we have Dr. Dheeraj Punjabi with us. Welcome, Dr. Dheeraj.
Hello,
Uh,
everybody.
he is one of the leading practitioners in Mumbai and specialized in general dentistry with this focus on cosmetic dentistry and implants. In this session, we'll talk about some precautions that we can take to maintain our oral hygiene, some myths and some facts, and some funny stories about the patients and how he is managing his practice and growing his practice. So,
Thank you so
first
much,
question.
Vaibhav. I would
Yeah.
like to extend my heartfelt thanks to you to be doing this Q&A with me. I love speaking about usually we are so busy in the rut of our practice, we don't look back and reflect what's happening. So I like to speak about what I'm doing and helping my fellow colleagues out there. It's fun. Sometimes there are some incidents which do happen, as you mentioned, some funny episodes. So I have loads in my bag. So let's see how we can unload our brains here and give you what you want.
Great. First, I want to understand how did you become a dentist? Was while as a kid, while growing up, were you looking up to someone? How did this happen, sir?
Going down the memory lane, I think back in 2003, SSC clearance zone. So SSC हो गई थी, and post that it was always in my mind that I want to do something different. I used to love science,
Mhm.
and I really used to love creativity. Now, when I saw my career options, trust me, I saw dentistry as one of the career options. It was not by default. Most of the cases में क्या होता है, मेडिकल नहीं हुआ तो डेंटल हो जाता है, डेंटल नहीं
Ah,
हुआ तो फिजियोथेरेपी.
right.
But I was so focused on dentistry, because there was no background, frankly. I'm from a family of businessmen. My father is a businessman. So he always expected that I take up commerce and I learn accounting and learn so many things which are required to run a business. But it so happened that I was intrigued. I was all the time intrigued by something fascinating, science, science backed and all these things. So this led to a decision of taking up science, and then doing my 2 years of science, and then taking interest in so many innovations which keep on happening. So वो डेंटिस्ट के पास जब गए थे तो एक बहुत कीड़ा था कि
हाँ
ये सारी मशीनें बहुत मस्त है,
हाँ
ये
हाँ
जल्दी जल्दी काम करती हैं,
हाँ हाँ,
मस्त मतलब अच्छी हैं, कुछ तो
right.
है. तो इट वाज
हाँ,
लाइक ऑलवेज इन माय माइंड दैट यू नो it will be fun being a dentist, isn't it? I mean, when I was in the dental chair back in my childhood days, the dentist used to have all the control, and it's always, you know, it's like if you have all the control, it's so much fun. So that time it was just an idea like that कि कुछ innovative करना है, machines के related करना है, science backed करना है. So that led me to select dentistry.
Okay, great.
And fast forward till today, I am still enjoying my dentistry, which is innovating, which is so much advanced now. I mean, it is so different than what we started. So
So, do you remember your first day as a dentist? Do you recall what happened? The first day as a dentist?
yes, I do remember first day as treating a patient in a clinic, and my heart was pounding more than the drill. At
Okay.
that point of time, I realized something, that being a dentist, I'm not supposed to just take care of the teeth. I'm supposed to take care of that person as well. There was a lot of anxiety to handle the patient on the chair than handling that painful tooth. So that's my experience as a dentist on day one.
One fun question. Have you ever looked at a stranger's smile and diagnosed them mentally? कि थोड़ा कुछ गड़बड़ है, कुछ हो सकता है, ऐसा हुआ है?
I think that's a good one. Why? Because we dentists are trained to look at teeth. I mean, frankly, hand on heart, when we look at anybody, the first thing to look is the teeth. You
Right.
know, so our eyes have become like X-rays. You can see through the patient based on the smile. We keep commenting. When dentists are together, and probably my wife is also a dentist, Dr. Poonam. And when we are back after attending a party or a marriage, we say, उसके दांत बहुत पीले थे, उसके दांतों में गैप था, उसके दांत टेढ़े मेढ़े थे. तो
वो
this
तो
has become a in built mechanism, I can say.
हाँ,
So
राइट.
yeah, I mean, looking at the patient's teeth, we definitely do our a diagnosis as in what patient should need or what patient should ask for to a dentist.
Okay, so let's move on to the new section. So let's talk about oral cancer. So
Yeah,
oral cancer makes up to 40% of all the cancer that happens in India, which is a which is a scary number.
that's
Almost
true.
70,000 diagnoses every year, 50,000 deaths every year. So what is oral cancer और इंडिया में इतना उसका क्यों इतना ग्रो कर रहा है ये?
See, first of all, you have to understand why do we get or why does someone get oral cancer? So it is an amalgamation of habits. Basically, if you see almost 50 to 60% of the population is a rural population still in India, and they are not aware of the effects of certain habits, what they inculcate
Yeah,
themselves right from a very early age. Some of them being tobacco chewing, alcohol consumption, some, dentistry done in the mouth, which is irritating, like, a tooth which is very sharp, or basically not maintaining a good oral hygiene. So I
mm,
think these are a few reasons which come to my mind, which could lead to oral cancer. How do we come to know that, oral cancers are developing? So it can develop a non-healing into a non-healing ulcer, an ulcer which does not heal despite all the efforts being made.
okay.
Sometimes there could be some red or white patches developing in the mouth, which can be diagnosed easily by a dentist. So I would recommend regular dental care here. Also, there could be some changes in the mouth where the opening of the mouth reduces. So normally जब हम माउथ ओपन करते हैं तो करीबन हमारी 3 उंगलियां जो है मुंह के अंदर जानी चाहिए.
Right.
And if at all this starts reducing and you are already under the influence of certain habits, like I mentioned before, it's a good time to see your dentist or take some advice from a healthcare provider who can guide you very well after this. Because I think prevention is the best medicine here. You have to take control of the habits. You have to get yourself checked. And I mentioned oral hygiene.
ओके, सो इज इट क्यूरेबल? अगर किसी को हो जाता है, किस स्टेज पे अगर पता चलता है तो इट्स क्यूरेबल और इट्स नॉट? आई मीन एक बार हो गया तो व्हाट कैन वी डू?
See, it's like a ticking bomb, how a ticking bomb gives you some scope of being diffused, उस
या.
bomb को हम diffuse कर सकते हैं. So similarly, if things are diagnosed at the correct time, if care is given at the correct time, सबसे important होता है diagnosis. If the diagnosis is made correctly and if it's not spreading, or by spreading I mean a scientific term called metastasis, जब कैंसर लोकल होने के बाद जो शरीर में फैलने लगता है, इफ वी कैन टेक कंट्रोल एट दैट पॉइंट ऑफ टाइम, जैसे मैंने बताया, इसके जो इनिशियल सिम्टम्स आते हैं, इनिशियल साइंस जो हमको मुंह के अंदर दिखते हैं, इफ वी कैन टेक चार्ज ऑफ दैट, आई थिंक वी कैन विन ओवर इट.
इसी के एक क्वेश्चन था रिलेटेड टू दिस. सपोज आई हैव एन समवन हैज एन ओरल कैंसर, because obviously I don't want to have an oral cancer. If someone is having oral cancer, can it go to the other part of the body as well? Is there any chance?
Yes, as I just told you, when things are at a local level, I mean, if you're talking about a body part or if you're talking about a location in the body,
हाँ,
if at all it's not diagnosed at the right time,
हाँ.
the cells what keep on multiplying in cancer can leave the site and enter the other parts of the body and start multiplying over there, which can lead to cancer in various other parts of the body as well.
Okay. Okay. One very basic question, but an important one regarding brushing. How to brush, which toothpaste, electric, regular. Please throw some light on that.
Well, that's my favorite topic because almost all the patients in our practice ask about brushing. Doctor, which kind of brush you recommend? What kind of toothpaste? How much toothpaste? How many times?
Mhm.
But it starts very funnily when I start asking them about how many times they brush, and a standard answer I get is 2 times. And when I dig a little more deep, I come to know that two times becomes sometimes, because when we look into the mouth and when we do a checkup, the gums are still bleeding.
Uh-huh.
So that tells me brushing is happening, maybe,
Mhm.
but probably it's not happening the way it should happen, or it is not clubbed with additional care which needs to be taken with the help of flossing. If viewers are aware about flossing, flossing is also an aid to keep the teeth surfaces clean. So brushing with flossing can bring a lot of improvement in the oral hygiene, in the oral care, and ultimately it can lead to a lot of prevention of diseases like gum diseases, tooth
Right.
diseases like cavities, and ultimately we can prevent some irreparable damages like a loss of tooth. We can prevent it at a very early level if we are allowing the patient to be checked every year.
Right.
First of all, we are doing a comprehensive checkup in which we are just not looking at the problem. We are looking at almost all the teeth which are present in the mouth. It's
Mhm.
called 32 teeth
Okay.
checkup, which we usually do in the clinic, because we only not need to treat. As dentists, it's our responsibility to even prevent things. As you said, I like prevention, because prevention is the best
Yeah.
thing what we can do to our patients. So yeah, I think coming back to your question, brushing needs to be done in the correct way. Your dentist is the best person to tell you how do you need to brush. Uh, Parents teach you brushing in the beginning of in the beginning of life, but that is supposed to be taken over by a dentist at an age in which the child becomes very cooperative when they can handle brushes by themselves. So at the age of around 4 to 5, it's a good time to teach them brushing. And yeah, two times brushing is important. It's very easy to actually answer this, that the number of times you eat your food and just grind them into small particles, they get deposited on your teeth. So the number of times you eat,
Yeah.
that many number of times you
Yes.
brush.
Yes. Okay.
And it remains incomplete without flossing. So flossing is something which should be an integral part of the routine oral hygiene care.
So, yes, the thing that you mentioned about preventive dentistry. So, we'll talk about that as well. Before
Yes,
that, in India, normally oral hygiene, oral health awareness पे पता नहीं है लोगों को ज्यादा. एक कॉमन नोशन है जब दुखेगा, जब जब ब्लीडिंग होगा, जब सीरियस होगा तब जाते हैं. तो व्हाई डू यू थिंक
correct.
दिस, ये ऐसा सिचुएशन क्यों है हमारे यहाँ? डू यू थिंक देयर इज अ लैक ऑफ अवेयरनेस और पीपल जस्ट इग्नोर इट? And then throw some light on the preventive dentistry which we were talking about, that how do you do it in your clinic?
Right. The first part, when you talk about awareness, slowly but surely, people are getting aware of, all these kind of diseases in the mouth. Even the urban population, uh, at some point of time, was not bothered or not aware of
Mhm.
these kind of situations. But slowly but surely, things are changing. Dentistry was never so advanced, so easy to be done as we see them now. Basically, the scare of going to a dentist, or
Yes.
the pain factor is the repelling part, is the repellent actually. It's not that patients are not aware. Yes, they are very much aware because of all these advertisements going on, the toothpaste advertisements and so many things which we see around us.
Yes.
But then it's the fear of the past experience sometimes which
Yes.
refrains the patient to visit the dentist. So I want to tell my viewers that dentistry is not as pokey or as bad as it was, few years back, because now with so many advanced techniques, we can actually diagnose diseases at a very early stage. So coming to the second point, the preventive dentistry, what you asked me, is something which I live with every day, because our mission is to help every patient, be aware of their problems first. The second thing is the education. Correct education will lead to a correct approach.
Right.
And then with the correct measures to be taken to eliminate or to prevent the disease is the most important thing.
Right.
So yeah, I think preventive dentistry plays a major role in any clinical practice where dentistry is being practiced as a full-time profession. And preventive dentistry should be an integral part of, I mean, looking at a patient when we are doing a consultation. We are focused on the other areas of the mouth as well and guiding them about basic treatments like a teeth cleaning and polishing, which takes care of the overall hygiene, doesn't let the tartar accumulate between the teeth.
Right.
Or something like sealants. Now, sealants are very simple to do cavity fillings without using any drills. Just a layer of a material on the tooth which protects the tooth for a long period of time from cavities. So, one more treatment which comes to my mind is a fluoride treatment. Now, this fluoride is an important mineral which keeps the integrity of the outermost layer of the tooth, which is called the enamel. So to make the enamel strong and resistant to cavities, it's very important to make it, filled with a lot of. So for example, if in winters the skin becomes very dry and it needs something like a moisturizer, yeah. So you give the portion of the moisturizer and the skin becomes soft and supple again. So the same way, if the enamel needs to be protected, it needs to be given what it needs. It's fluoride. Now, fluoride is a mineral which is absorbed by the enamel, which increases its strength and the resistance to having a cavity. So our mouth pH, if you understand, keeps on changing because we consume different kinds of foods.
Right.
So mostly when we eat or drink any kind of food or beverages, it can turn into an acidic environment, which is very good for bacteria or germs to multiply and then cause cavities. So fluoride also plays a very important role there in resisting this acidic environment to be formed around the teeth. Of course, it has to be clubbed with proper cleaning, hygiene, and flossing, which keeps the tartar away, which has the germs. But uh, it's a fantastic treatment in which it's like an insurance. I call it an insurance. It's a very cheap insurance what somebody can take
Right.
to prevent their teeth from having a cavity.
Okay. Now let's move on to the some lighter, section. We talked about some
Yes.
serious stuff. So now I want to know the funniest excuse a patient gave for missing an appointment.
Yeah. So it was winter and my dog was suffering from fever, so I couldn't make for the appointment.
Great.
People love pets more than their dentist.
Great. Okay, okay. One thing that patients do that annoys doctor the most.
So, what I said, like when I tell them how many times you brush, and it's like 2 times a day, and that 2 times becomes sometimes. That's the most annoying part. I mean, you have to be open to your dentist, right? Like the way you are open to your advocate or a legal advisor, you are open. You have to be open to them, right? So you need to be open to your dentist to tell what are you doing and what are you not doing. So that annoys us sometimes, but doesn't matter. It's a part of the routine. We handle it very well.
Okay. Have you tried treating yourself, sir?
Ah, okay.
एंड हमारा ये क्वेश्चन रहता है कि अगर डेंटिस्ट को कुछ होता है तो वो कहाँ जाते हैं, वो अपने असिस्टेंट को बोलते हैं वो व्हाट हैपन, और जस्ट अपने ऊपर ही एक्सपेरिमेंट करते हैं, यू ट्राई.
So I tried, frankly, I would be speaking the truth here. So I did, try to clean my wisdom tooth myself using something called as a scaler, which most of the audiences must be knowing. It's a tool which helps you clean the area between your gums and the teeth. So yes, I have done that, and I've got good relief with it.
Okay. Great. So moving on to the next section. What snack do you secretly love? And even though you tell patient not to take it, but you still have that snack. What is that one?
I think that's a samosa. I
Okay.
hope they are not listening to me.
Which celebrity smile do you think is a perfect?
Okay. Okay. So I'm a Bollywood person, so I would talk about Bollywood. In Bollywood, I think Hrithik Roshan is someone who has a very good smile, which suits his face.
Mhm.
So yeah, I think Hrithik Roshan is the answer.
And which celebrity needs some treatment, or you can make their smile better if there are some celebrities.
Okay. Recently, I saw a video of Govinda dancing,
Haha.
the tunes of his own songs. And I think he needs
Okay.
some dental treatment. So I
Okay.
think Govinda will be the one.
आई थिंक लोगों का अभी तक फोकस नहीं गया हुआ क्योंकि वो इतना अच्छा डांस करते हैं, तो आई थिंक
Absolutely.
यस यस ओके
I told you, na, we look at the
वी
teeth
लुक एट
first.
द ओके ओके some quick rapid fire questions, sir. Tea or coffee?
T,
One gadget you cannot live without.
my intraoral scanner.
Okay. A favorite travel destination.
It's travel destination. It would be Australia.
Okay. And if not dentist, what profession you would have been in?
I would be a chef.
Okay. Morning cleaning time or evening cleaning time? What do you prefer?
Morning. I'm a
Okay.
morning person.
You're an early person, morning person. Great. Extraction or root canal, which is tougher?
Extraction.
Okay. Most common dental myth that you hear.
So this is myth given by almost 70 to 80% of the patients that दांत का इलाज करने से आंखें कमजोर हो जाएगी क्या? So
Okay.
it's like does my eyesight get affected when I'm getting a dental treatment done?
Okay.
So that's the myth I commonly listen to.
All right. Okay, so now let's move on to a section where we'll talk about your practice and how you're managing it, how you're growing it. So how do you strike a balance between providing the high quality treatment and meeting the expectation of patients about the pricing? So how do you manage?
So let me talk about what we believe in. So what I believe in is giving quality dental care and doing dentistry from my heart. Okay, for my patients because I want to give my patients the best what I know and what they deserve.
Yeah.
So what strikes a balance between this, what you said is actually educating the patient about the know-hows of the treatment, about the options which are available these days regarding any kind of a treatment, what they require, and ultimately just be transparent with them and co-discover a lot of things with them. As in कभी कभी ऐसा सवाल भी आता है कि डॉक्टर साहब अगर आपको कराना होता तो आपको क्या सो आई वुड गिव माय ऑनेस्ट आंसर द ट्रीटमेंट व्हाट I would do in my mother, in my sister, in
Right.
my spouse's mouth.
Mhm.
I would do the same in your mouth. If I require that kind of dentistry,
Mhm.
I'm offering that to you. So that is something which is a win-win situation for I think a win-win-win situation where my patient is happy. I'm happy delivering the quality practice, which strikes a balance with the costings what we give to the patient and leads to a profitable practice as well.
क्योंकि दिस इज अ वेरी कॉमन थिंग बिकॉज डेंटल पे पैसा खर्चा करना है, दांत ही हैं ठीक हो जाएंगे, एंड मेनी टाइम्स इट हैपेंस जैसे कि हमने बात की कि अवेयरनेस उतनी नहीं है, एंड वी टेंड टू डिले दिस थिंग्स, बट इवेंचुअली वी
Right.
एंड स्पेंडिंग मोर इफ वी don't focus on the preventive care or the basic things, regular visits to your dentist every 6 months. If we at all, I mean, सब लोग ऐसा करते हैं, तो this thing can be avoided. Now, do you think practice management software is must for a clinic, and what are the ideal features that practice management software should have?
Yeah, that's a good one because a practice management software is like the skeleton a body can have, So a practice management software is an integral part of any practice, what I feel, because it gives you so much. It gives you so much of information coming from the patient. It gives you a chance to get connected to your patients again, to keep in touch with the patients. We regularly send them their invoices, their case papers on WhatsApp. So I mean it's become so easy to keep a communication with them. It's easy to wish them on their birthdays, which regularly happens through CRMs, which are available in this kind of patient management softwares. We can store so much of data like X-rays, photographs, and so many things what we do while we are seeing the patient. So I think all in all, it's like the hand and it's like the hand and foot of my practice. So I would definitely recommend any practice management software.
Because normally dentists think that a practice management software is only there for record keeping. बस पेशेंट
Mhm.
को अपॉइंटमेंट के मैसेजेस चले जाएं उतना ही हो सकता है, लेकिन देर आर फ्यू सॉफ्टवेयर दैट कैन हेल्प देम ग्रो द प्रैक्टिस एज वेल, ग्रो द रेवेन्यूज, ग्रो द प्रैक्टिस, improve the patient engagement retention. So I think that's a fair answer. And
Absolutely.
yeah.
So I'm a ardent Vestosis user since last 8 years now, and I would say I can just pull my reports so easily. Otherwise, they're so difficult to manage, store, and maintain. The stuff keeps changing, but the software remains the same, so that I can pull out data from any time of the year, any time of the last few years where we have practiced to see what's working, what's not working,
Right.
what should be the strategy of things about things which are not working for the practice. And I think I've seen a lot of personal growth in managing my practice with the patient management softwares.
Great. What's a small success in your clinic that you made recently?
So recently we bought something which is called electric motor. Now this electric motor is very much different from the routine motors which make a lot of sound, and that zoom sound is not tolerated by the patients,
Okay.
including us when we
Okay.
are using this kind of tools. So
Mhm.
we recently invested in something called as electric motor, which doesn't make the sound, doesn't give you the spray of air, and does the job like a butter on a knife, I mean, the knife running on a butter. So it makes the procedure so easy, and it is so comfortable without any vibrations, without any sound. So that has added a lot of value to my patients.
Okay, great. What's your secret weapon for running a smooth clinic?
Secret weapon, it's education. Education, education, education. Just keep educating your patient to a level where you and the the patient comes to a consensus and a literal understanding that yes, this is for me. This treatment is for me. So convincing is something which doesn't work for me. Educating is something which works very well for me.
Very, very well said, sir. So I think that's it for this session, and thank you very much for giving your time for us. And I'm sure the viewers will get a lot of insights about their dental health through this. And to all the viewers, I mean, visit your dentist every 6 months and brush twice a day. That's the minimum thing that you can do. Brush twice a day, floss around, and for the God's sake, stop Googling your symptoms. Go to your dentist. Any last words, sir?
Yeah, so Google has become the past now, what I see, and people are focusing more on AI.
Uh,
AI is a wonderful tool to educate you about your problem, but again, the artificial intelligence needs to be backed by a natural brain, which
yes,
is here
yes.
with a dentist. So AI can guide you, but dentists can treat you very well.
All right. Yeah. Thank you, sir. Have a good day, sir. Bye.
Thank you. Thank you, everyone.